issues of mental health and mental well-being. How are counties addressing the issue of mental health and burnout among healthcare workers, and specifically nurses? So mental health issues and burnout. Thank you.
Thank you very much. We know that mental health have come to the forefront, especially in discussions concerning healthcare workforce. And nurses are especially affected by this because of the long working hours. It's, working in emotionally taxing environments, and also the burden of caregiving, because nurses are the ones who do the caregiving in our facilities. I know that across the 47 counties, we have launched mental wellness programs, and I know my sister Katra sitting there, she's the Director for Health in the Council of Governors. She has a very robust plan. I know she has started working in some counties. If there are people here from Nakuru County, you know she has been to Nakuru County with that program, and it's an ongoing program that we are really seeking partnerships to ensure that it is rolled out in all the 47 counties. But we try to provide counseling services, stress management programs, and more especially, counties try to provide a very conducive environment to enhance the overall well-being of nurses. Thank you.
Okay, we have a minute or so. There were some hands up. Do we still have questions? Yes, there are questions. So shoot, and then there's no mic. Okay. So one question, and then there. I think we can take. Can I have 10 more minutes, please? Okay.
Okay, thank you. Allow me ride on the existing protocols. I'm Margaret Lokota Ekwam from Turkana County, the cradle of mankind. Your Excellency, I believe you will answer this question on behalf of my able governor, Jeremiah Lumurkai. How does the county plan on the welfare of nurses, especially who are working on the underserved dispensaries, especially in securities? Recently, for the past 2 or 3 months, we've lost a number of nurses through banditry and other calamities. And it is very unfortunate because it's like there's no life that has been lost, and we are actually, we feel so much pain, and we don't know what are the plans. Kindly, may you respond on behalf of Turkana nurses. Thank you.
Can we have maybe 3 questions before they respond?
Yes, I think I can ask a question. My name is Ateka Kadu from Nyamira. I have 3 issues. One is touching mental health. I think as we all said and we know, nurses will stay with patients bulk of the time. The doctors will come, prescribe and go. The clinicians will come, prescribe and go. And ours is to stay with the patient 24/7. Now the issue is, what we undergo with the patients. Yes, we have facilities. As Your Excellency, you said we opened several health facility dispensaries across. But do we have all that is enabling in these facilities that we are opening now and again? We just opening a facility and we're sending a nurse there. Nothing, no drugs, nothing. A patient will come, there's nothing. And the patient will be in the ward, needs a certain procedure, but we have no tools to work on. All those are major issues. What are you as the Council of Governors? What do you have in mind for the nurses? Because the nurses are getting tortured. The second concern is what the other lady had asked about the BSNs. For sure, we come from counties, and as you said, as an is not, we're not only employing the BSNs, that is very not true. The counties will advertise for jobs. They will advertise for enrolled nurses and diploma nurses and not BSN nurses. And that is the truth. Kindly, we should think about it. These are our daughters. They are our children that we schooled. We are embracing nursing to go as a probation. And where are we taking them to universities? We are not employing them. The third one is about the nursing as a profession. We know nurses are the majority in our counties. And then, if we did the inventory, how many counties have directorate of nursing at the county level? Very, very minimal. Why is it that we don't have directorate of nursing at the county levels? Kindly, please, if you answer that, I'll be very comfortable.
Third question.
Good afternoon, everyone. My name is Wanjiru Florence. I come from Nyandarua County. My first concern is about, it's a mental health issue. Time and again, nowadays we've had our nurses committing suicide, and there is a cadre that has been forgotten, is the team of the UHC team. If today we were to have a pandemic, what would we do? We have forgotten that team, and these are the people who are committing suicide, and they are nurses. And kindly, let us look onto that, because it is not a county issue, it is a national issue. The other one is about the time frame. This is the 66th conference that we are having.
Kindly summarize.
Are these the same issues that we are going to ask next year when we come for that conference? We need a time frame for the same. Thank you.
Okay, I think we can take those three questions, and then I need the mic on this side, their questions, as our panelists respond to those three questions.
Okay, I'll try to answer some of the questions, and my colleague here will also add. As regards the security issue in Turkana and many other counties, we know Baringo, West Pokot, and so on. Yes, that's a challenge we are facing, but this is a national challenge. It's not an only county challenge. So what I would like to say is that as Council of Governors, we are working with the national government, particularly the Ministry of Interior, to ensure that the security challenges that are being faced in these areas are addressed. And it's a matter that is of interest to us as Council of Governors. And therefore, we will continue to address that issue with the national government. As regards the directorates of nursing, yes, your point is very clear, and it's true that that should happen, and quite a few of the counties have started establishing that. I'm well informed, like Machakos has already taken precedence in that. But I would like to request the leadership of the Nursing Association of Kenya to put that as an agenda which you can then forward it to the Council of Governors so that it is addressed holistically, so that we all address that issue as all the 47 counties are not in ad hoc manner. So if that comes, I want to assure you that we will act in the positive to ensure that nursing gets a directorate in all our structures. So that's what I would like to say. I would like to let my colleague elaborate on the other issues.
Thank you very much, Your Excellency. There's the issue of facilities being built. I really don't know how to answer this question, but I just want to say that where we sit, where the governor sits, where we sit as CECs, we might not be in control of some of these things. Some of these facilities are built by the insistence of our legislators, who are also elected leaders in the county, and we can't stop them. And for sure, there are some areas that really need facilities. But what we keep saying, and that is also the position of the Council of Governors, a health facility is not like a water project. You know, when you build a water project, all you need to do is launch, open, and people start using. So we are now at the point as collectively as 47 counties where we are saying what are the established needs. We might not be able to reach the WHO requirements for distances between health facilities. So we need to look at our numbers and again, as I said earlier, cut our coat according to the size of clothes. But when you talk about equipment, it is not possible for us to operate without equipment. For us to provide services in health, we must establish adherence to all the building blocks of health. So I think let us not overemphasize that we are doing some things. Let us just talk about what seems to be missing. On the issue of having a directorate, I think this is the responsibility of the county nursing officers to bring it up in the individual counties, establish a conversation through the county director of health, come to our offices as CECs. Let's have a conversation, let's have justification. Then the CEC takes this to cabinet and it is done. This is not something that can be done at the national level. It's not something that can be done in all the 47 counties. I know Machakos has that, but it depends on how they approach it. Let's also do peer learning. Let's learn what a county did to get what they have. I know you have a forum. I hope it's possible that you have, an organized forum. And I want to tell you that we recognize and appreciate nurses. Our Director of Health at the Council of Governors, Katra, is a nurse. So it is not that we are not recognizing nurses. What I want you to do is make use of her position and her being one of you. And I'm requesting Katra, if it was possible to have a quarterly forum